has a problem with hearing us. Is there anybody else here present that have some issues with the tone?
Sonia had problems, I think. Sonia, are you okay now? Okay,
no, I can't hear it with my headphones, but I can hear it with the other micro. So fine.
Okay, great. Perfect. Alenka, when you're ready, we can start. You're muted, Alenka, so unmute yourself.
Okay, hello everybody. Good afternoon. I'd like to welcome you to a webinar which was entitled Empowerment of Older Persons in Regions. My name is Alenka Rajai, and I am a coordinator of the reference site Slovenia. Victor, okay, just another slide. We are located at University of Ljubljana and one of the faculties for chemistry and chemical technology. And we are organizing this webinar with the help of Slovene Business Association, which is our liaison office in Brussels. And this research, this webinar, this event was originally planned as one of the events during the European Week of Cities and Regions. And afterwards, we were planning for a nice wine tasting of Slovenia and, of course, networking, because a lot of ideas and most of ideas really come about when people talk to each other. Unfortunately, the situation has changed completely, and our lives have changed dramatically because of this COVID situation. And we are really grateful that the team of We for AHA was able to organize a series of seminars which are taking place during October and November. The downside of these webinars is that we do not meet in person, but the advantage is that more people can participate. This empowerment aims to increase healthy lifespan of older citizens, enabling them to have better control of their lives. Innovation provides tools for implementation of alternative care models, also outside institutional healthcare. So in this workshop, we will have the opportunity to learn about various projects, digital and non-digital, from 6 reference sites, with the final aim to send to European Commission the recommendations that would help shaping the future policies to empower the older persons. I would like to welcome representatives of European Commission, DG Santé under Elizondo Zsagori, I hope this was correct, and from DG Connect, Irina Calderon Libal. I would like to welcome representative of Active Assisted Living, Klaus Niederländer, and I would like to welcome the representatives of ERIN. They are our moderators in the breakout sessions, Lucie Durochet and Henriette Hansen. And most of all, I would like to thank again the team of We for AHA, especially to Annette Rushanov, who was really helpful in helping us organize this event. I think we can move on. And I just like to stress that the reference sites are really a base where also European Commission can test what solutions work. And they are really inspirational ecosystem delivering creative and workable solutions. And also our workshop, our webinar will bring a small stone to the knowledge, to the attention of European Commission, so they would be able to shape the policies in the future. I will move now to, I will give the word to Victor to tell something about these technical instructions. I mean, it's going to be, the technical part is being handled by our SBRA office, and I give the word to Victor now. Thank you.
Thank you, Alenka. Hello, everybody. My name is Victor. I'm working for the Slovenian Business and Research Association. As Alenka already said, it's the liaison office here in Brussels, and Slovenian Innovation Hub, and also reference site Slovenia is one of our members. Allow me to brief you a bit about technical instructions. Namely, today we will have 3 sessions. First is an opening session where everybody will be together, and then the opening session will follow the so-called breakout sessions, 2 breakout sessions, where participants will be automatically divided into 2 groups, 2 rooms. Because we have a number of participants. I would kindly ask you for your patience, because the system will do it automatically, and of course speakers and moderators will be handpicked and put into the right session, into the right room. During the breakout sessions, the reference sites will be presenting their best cases. I would like to remind you that there will be no PowerPoint presentations, only visuals, but PowerPoint presentations are available on the EIP on AHA website, and also will be available on our website, on the sbra.v website. And if you have any difficulties getting them, just let me know and I will send you a link. Before giving back the word to Alenka, I would like to remind you that, of course, your microphone should be muted at all time. If you have any questions, especially during the Q&As session, please leave your questions into the chat message box. And if you need any help, raise your hand. Boštjan Šinkovec, my colleague, and myself, we will try to help you out if needed. After the breakout session, we will come back again together into the one session. It's called the closing session, where we will finish our common event. But in between these sessions, some automatic division and coming back. Probably the system will take some time, and again, please be patient. Now I'm giving the word back to Alenka. Please, the floor is yours.
Thank you, Victor. I hope everything is pretty much clear. Otherwise, we can always use chat. And now I would like to invite the representative of European Commission, DG Santé, Andre Lustondo Jaregui, I hope. I don't know whether I pronounce it correctly, and I apologize if I don't. And I thank you again for taking time to participate in this workshop, in this webinar. And I invite you, Andre, to tell us about what is European Union, what is European Commission thinking, what is they are planning regarding empowerment through digital tools. The floor is yours. Thank you.
Many thanks, Alenka. Many thanks, Victor. Just a question, the slides will be shown, or?
Yes, the slides will be run by me, but I would kindly ask you if you could just mention the next slide, and I'll do my best to follow you.
Yeah, because I still see the speaker. Yeah, so my name is Andre Lustondo Jaregui. I work at DG Santé, the Director General for Health and Food Safety at the European Commission. I come from the units for European reference networks and digital health. I will talk about different aspects of patient and citizen empowerment through digital tools, mainly from a European perspective. Next slide, please. Yeah, I'm planning this intervention or this presentation to take around 15 minutes. So I've divided it into two different sections. First, I would like to talk about the digital tools themselves and citizen or patient empowerment. And then the second part will be more on telemedicine or digital health services within the vision of the European health data space. Next slide, please. So let's, next slide again. I think first it's important to have a clear view of what we mean by patient or people empowerment through digital tools. And here we typically talk about how we can provide control, or we can allow patients and citizens to gain control over their health condition or their health status, or also to increase their capacity to act or to react to this condition. I think this can be summarized very clearly with some questions. So me as a citizen or me as a patient, for example, how can I or what can I do to manage my weight if I'm overweight, or if I suffer from diabetes or hypertension, what can I do? What is under my control so that I improve my condition? And similarly, we can also extend that, and I think it's especially relevant for elder citizens. We extend that to mental health, for example. What can I do to keep my brain healthy, for example, against memory loss? Next slide, please. Yeah, it's also important to, when we talk about empowerment, to also see what factors could influence the empowerment of citizens. And here, I think it's very relevant to talk about the ability, motivation, and opportunity framework. This is very much based on the ongoing work of the eHealth Action, which is the supporting joint action for the eHealth network, and the work is expected to be finished by the end of this year. So there are three main elements, three main columns here: ability, motivation, and opportunity. The first one is related to how citizens or how patients can gain the competencies, can gain the knowledge to control their health status. So here, if we translate it to digital tools, then it's about, for example, the digital tool providing truthful but also actionable information. For example, following the case of overweight citizens or patients, then okay, what can I do in terms of exercise, or what can I do in terms of nutrition? What are the recommendations that I should follow? But sometimes it's not enough can you go back to the sometimes it's not enough to just have the ability. It's also a matter of having the motivation. So the desire to engage with these tools, and also the desire to engage in the process. And here, when we talk about digital tools, gamification is a very typical resource that many developers or many entities developing this kind of tools use. But sometimes there are also other means that could be used. Think about, for example, data access and control in the case of patients who suffer from a disease which carries a certain stigma. And here, for example, in this case, privacy preservation can be very, very important. So they may be motivated to switch or to use a digital health tool that provides this kind of privacy preservation. And then the last element is opportunity, very much related to the availability, affordability, and accessibility of these solutions. And here I think the very clear example is reimbursement. So how can we make sure that the use of these tools is not a burden, an economic burden on patients and citizens, and how can national healthcare systems or regional healthcare systems provide support for that? That's all for this slide. Then, of course, there are a number of benefits that we could cite when talking about digital tools. I think the most obvious one, especially now in the case of COVID-19, is that they may allow overcoming physical barriers. And one of the things that we've seen is also that during the COVID-19, there has been a steady uptake, well, not a steady, but a dramatic uptake in the use of these kind of tools. But it's also important to explain that digitization is not necessarily empowerment. So there is a need to find the right balance. There is a need to integrate these digital tools in the clinical workflows and the administrative workflows of healthcare systems. And I think this is a very important element when especially engaging in actions related to digitization, because it's not only about providing the digital tools, but it's also about capacity building and change management, even at the lowest level. That's all for this slide. The next one, please. So now we're moving on to the second part, where we talk about the role of digital health services and products in the context of the European health data space. So as already announced in the European strategy for data, one of the pillars of action for the European Commission is the creation of a common European health data space, which provides timely access, but also exchange of health data. But we have different use cases in mind, not necessarily only the provision of healthcare, the provision of health services, but also secondary use of health data for policymaking, for regulatory activities, and also for research and innovation. These are the three lines that you can see, or the three rows that you can see on the screen. And then there are a number of work strands that we are working on. The leftmost one related to the governance rules. So how can we make sure that there are common governance frameworks, common governance structures, access rules that govern this European health data space? Because in the end, we don't envision this just to be a common repository for health data, but more an open ecosystem, an open environment where health data is transferred securely and properly. Then there is also an element of quality of data. This very much relates to semantic interoperability. And here there are projects of verification, for example, or the actions related to the European Electronic Health Record Exchange format based on the recommendation from 2018. The third pillar is related to infrastructure, very much related to linking different repositories, linking different authorities that are appearing in the member states. And I think here it's also important to mention the importance of data permit authorities with special reference to the efforts of Finland, for example, with FinData. Another example we have in France with the French Health Data Hub. Also in Denmark, we see similar initiatives, and in Germany. And then the last one is, as I was saying before, the element of capacity building, because this change towards digitalization is possible without capacity building at member state and also regional level. So this is more or less the framework of the European health data space and where digital health services fit in. Next slide, please. Yeah, it's also important to see a little bit where we are at the moment. Of course, that's the vision, but we also see a little bit what the present state is. These are figures from 2018, a report that was commissioned by DG Santé. So the numbers that you see for 2019 and 20 are extrapolations of the data that the contractor gathered. But what we see is that, of course, there was an update, a gradual update of telemedicine, but we also see that the European Union also had a certain, let's say, room for improvement when compared with the leaders in this area, in this case, the United States. And of course, with COVID-19, we know that the numbers have gone up, but we can also assume that the gap has probably not shrunk necessarily. So it's also important to think about how we will develop this framework of the European health data space. And for that, I would like to use the next slide, which talks a little bit of the next steps. So we're looking very heavily into the elements or the factors that are hampering the cross-border provision of healthcare services or telemedicine across the EU. And here we can mention a few examples. For example, the presence of different legislation in member states, lack of interoperability between national services, differences in approval, certification, authorization, and reimbursement rules and processes. But there may also be some other elements which could relate more closely to capacity building, as I was mentioning earlier, the access to health data, health services, also the part on digital health literacy and digital skills, not only of patients, but also of our healthcare professionals. So this is something that we are trying to cover in a study now to see what the status is, and this will be a study that will also feed into our work on the European health data space. Next slide, please. Yeah, finally, I would like to touch upon a little bit on the legislative initiative. This was already announced by Commission President von der Leyen in the State of the Union for 2021. But it's also important to mention the new European Health Program, which will support the rollout and the creation of the European Health Data Space, and also the reinforcement of European reference networks and their further development. But we also have the Recovery and Resilience Facility, which will be, or is expected to be, a very powerful tool for reform in member states and also at regional level. And this is especially significant in the health sector. And I think the call or the message here is towards the regions also to work with the national authorities to think about the gaps that are in the healthcare system towards digitization, and also to find the projects and elements that could be improved so that we can make the best use of this recovery and resilience facility. Yeah, that's all on my side. This is the presentation that I had. So thank you very much to everyone for listening, and yeah, that's all.
Thank you very much. It was very, very interesting, and I thank you also for keeping within your time frame. So we have the concept of this workshop was that it would not be just telling about the slides, but to have vivid discussion especially during breakout sessions. And your views are really very good outskirt for these discussions. And thank you very much again. The next speaker will be Vojko Kaučić. He is, I would say, he stayed in Slovenia because of the COVID, and this is kind of the good kind of the COVID situation. He's otherwise working in Institute of Gerontology in Wayne State University, and I think he can add another view to all what is done in reference sites or in our approaches to enable older citizens to have better control of their lives. He's working in cognitive training, and I would just like to give the word to Professor Kaučić to tell what were the findings of short research which was done in Slovenia, and then give, of course, the stress to cognitive training. Thank you. The floor is yours.
Hello, everyone. I wish you everyone a good and productive attendance of this webinar. And I have to also thank to Alenka and to Victor to invite me to this webinar aimed to talk about empowerment of older adults. I want just to say that my approach is a little bit different about empowerment, while we will see in here later on different kinds of very interesting programs and interventions how to empower older adults. I will talk from another perspective. As Alenka said, I was sequestered by COVID-19 in Slovenia. And while waiting to return to the United States, I got involved in the study on COVID-19 in Slovenia. So basically, we want to know how Slovenes as a population are dealing and how they are experiencing to the COVID-19. This survey was conducted in mid-April, just after the peak of the first wave. Now, unfortunately, we are facing second wave, and who knows what will second wave bring. But in that survey, there were also included 167 older adults, and so for all these people, we wanted to know what is their level of anxiety and what are some other factors that will affect or influence the level of anxiety. In this regard, we also measure the different kind of demographic data. Furthermore, we were also measuring the reaction to the restrictions, lack of necessities, difficulties caused at home, at work due to the COVID, and so, of course, health issues. We also ask our participants to evaluate their positive and negative emotions, and of course, the stress level. So the next part, you can see the histogram of can you push enter? Or click down. Okay, so you can see here the histogram, the distribution of the scores on the GAD. GAD is a questionnaire based, it's called General Anxiety Disorder Questionnaire. It has 7 items. And then you add up all the responses. As you can see, almost 20% of older Slovenes did not have any issues. However, the cutoff point here is 10. So whoever has a score greater than 10, we can consider that person to have a serious issues with anxiety. So now we add up all the percentages higher than 10, so we can evaluate that anxiety level in older Slovenes were around 13%. When we compare this 13% with some other nations in Europe or even United States, that we can say that 13 is a low level of anxiety. There are some other nations like UK and United States, they even reported the anxiety level as high as 25 to 30%. And in any case, elevated anxiety certainly represents serious mental health issues. Now, in addition to evaluate the level of the anxiety, please next click. We also wanted to know which are the significant negative predictors of the anxiety, and our statistical analysis show that the most important statistically significant predictors of anxiety are restrictions of daily living due to the quarantine. So we can say that initial first quarantine was quite tough on the older adults, and hopefully now, if we come to the level of another quarantine now, and I guess our government should know to better manage those restrictions. So the higher anxiety was also present at those older adults who have experienced a greater number of negative emotions like fear, like sadness, like depression, and also higher level of anxiety was related to the worrying. So those older adults who worry too much, who are uncertain about what is all this about? What is the future bringing? How we will get through this crisis? So that in that regard, then those people will have higher level anxiety. So our study basically shows that the general anxiety was very high in Slovenia. However, it identifies those risk factors which are very important to follow in order to manage or to prepare for those kind of actions and programs and interventions if we want to empower older people in order to help them to decrease their anxiety level. So in addition, I believe that the solutions for the future are that the government or the institutions within the government should be paying attention and should monitor those people who are at high risk, and they should monitor especially the high risk groups. And one of the highest risk group, as you well know, are older adults. And so that's important. And only when we know much more and much better what's going on with this COVID and how is COVID affecting everyone, primarily our older adults, then we can be better prepared and to prepare and provide interventions, primarily psychological, psychosocial interventions and assistance in order to empower people and not to face maybe the second wave, even though I'm not so sure how much can official agencies deal with empowering people for this health crisis. But I certainly believe that we can learn a lot from the COVID-19 all over the world, especially in Europe, if we want to help older Europeans to better manage next health crisis like COVID-19. Thank you very much for your attention.
Thank you very much, Professor Kaučić. It was kind of surprising regarding the anxiety with the elderly, but we can also improve that, as I know, with some training methods like cognitive training. But we will talk about this probably later in the during the breakout sessions. Can you give the next? Yeah, okay. The biggest thanks, of course, goes to the reference sites. We have here excellent work and excellent examples of good practices from 6 reference sites, 2 from Spain, Castilla y León, and Navarra. We have representatives from Central Denmark, from Skåne, from Sweden, from Crete, and from Slovenia. And I would especially like to thank again Dr. Klaus Niederländer for his presence from AAL. I will give you the floor, and I would ask you that when we are still all together in one session, that you shortly represent the thematic and, of course, your reference site, and then we will go ahead and go into we'll break into 2 sessions. Thank you. Can you just go by the alphabetical order? Klaus?
Okay, well, yes, thank you very much, Alenka, and great pleasure for us to be participating in this. Obviously, we are not a reference site, but actually we are working a lot together with ERP and AHA over the last 2 years. And in the end, we also, the AL program is actually, a public-public partnership of more national ministries of health and innovation and research with the European Commission. But we also have some of regions from Spain, from the Basque Country, from northern Italy, and also central Denmark, either directly or indirectly involved. So I think, and our projects in the end, which we are supporting and which I present a bit more our experience, actually happen in regions. So that's where the actual action is. And I look forward, to the discussion in a few minutes.
Yes. Hello to everyone. Can you hear me? Okay. You will share the presentation?
No presentation at this point, just a brief presentation of yourself and your reference sites and the topic, but more in details will go afterwards when we're in breakout sessions. Thank you.
Okay, perfect. Thank you. So I'm representing here the project Integra Atención, which is founded by Interreg POCTEC in Portugal, and we recently got the approval of a strategic partnership for innovation and active health aging, Integra Atención ecosystem as a reference site and as a model of comprehensive approach to active and aging. We are now implementing 3 innovative pilots with artificial intelligence, and I will talk more about that in depth later. Thank you.
Thank you, Paula. May I invite Karin to present Central Denmark?
Yes, hello, good afternoon. My name is Karen Tambo. I come from Central Region of Denmark. And my presentation today is about DIGIS. It's a project about digital competencies for healthcare and professionals. About the reference site I belong to is we are a 4-star reference site selected in September 2019 during the AAL forum in Aarhus. Central region of Denmark and Aarhus municipality are the main contacts. As an example of our ecosystem, we have digital flow of data across the 19 municipalities in our region and are working with a shared IT systems for better health. We are working with the European collaboration projects and innovative solutions in the area of health and care. I will explain more about DIGIS later then.
Thank you very much, Karen. I was in Aarhus and it was wonderful.
Oh, thank you.
Now I give the word to Fotini Conti from Crete. Fotini? Heraklion?
Yes, I represent. Do you hear me? I don't hear.
Yes.
Yes. Okay. I represent the Association for Alzheimer's Disease and Healthy Aging of Heraklion, Crete. And this association helps patients with Alzheimer's disease through cognitive rehabilitation, the caregivers through counseling and psychological support, and also we promote the healthy aging, conducting special programs like this one that I will present you later. We cooperate with the University of Crete and the municipality of Heraklion, and the association is a reference region for healthy aging in Europe.
I invite now Spain, Navarra, Professor Miquel. Navarra. Miquel Izquierdo.
I'm coming. Hello.
Oh, good. Hello.
Hello, everybody. I am Miquel Izquierdo from Navarra, from Pamplona. I am the head and professor of exercise science in the Department of Health and Science of the Public University of Navarra, and also working in the Biomedical Research Center, the Navarra Biomed, that belongs to the government of Navarra. For the next few minutes, I will going to entertain by give you a quick look on the maintaining or the importance of maintaining exercise always through life, but especially for older person during confinement or in hospital and staying at home period related with this tremendous time related with COVID-19. Also, I will show you some approach, a program, the BB-Frail multi-component exercise program that we have been developing during the last 10 years, and it was funded by the European Union. And actually, we are producing a lot of materials that we think can help to the older people at home or in hospital to be with good, healthy aging. Thank you. I see you in a few minutes.
I'm calling now Slovenia, Gora Skladnik.
Hello, my name is Gora Skladnik. I'm CEO of Provita company, consulting and business development company working in healthcare sector. We are a part of a consortium of companies operating within Slovenia Innovation Hub, and we are developing new approaches in healthcare, introducing combined approaches, including social innovation and ICT solutions.
Boras, we don't hear you well.
Should I speak louder? Is it better?
Your voice is kind of a cutting voice. So if you just speak closer to the microphone, it might be better.
Yeah. Okay. Our focus are new ways of interactions between the healthcare providers and patients, as well as healthcare processes, employing new health technologies, including ICT solutions and also health marketing approaches. This combination we call mobile health management, and our projects are directed to introducing of the mobile health management in different segments of healthcare. Thank you.
Goras, we hear you not so well. If you can find another pair of phones and with a microphone, it would be great for the next session. Thank you.
Okay.
Thank you. And now I give the word also to Skane, to Professor Staffan Karlsson.
Thank you very much. I'm Stefan Karlsson, and I'm a professor in health science in Kristianstad University, which is located in the county of Skåne in the southwest part of Sweden. As well, I'm a manager of this program I'm going to present, and it's about preventive home visits for seniors. And this is a collaboration program with 7 municipalities and county council of Skåne as well. But I'm going to tell more about it very soon. Thank you.
Really, thanks again to all the reference sites. You did really a wonderful job preparing, and because you are taking time in this, it's hectic times, and we are really grateful to you that you were able to take time and prepare all the materials which you are going to discuss later on. I will give the floor now to our moderators from ERIN. Please, the floor is yours to present yourself.
Yeah, I'll start and then I will give the floor to Henriette, if it's okay with you, Henriette.
Of course.
So I'm Lucie Durocher. I'm from the region Sud Provençal Côte d'Azur, based in Brussels and in charge of research and innovation, which includes also health. And together with Henriette and another colleague, Maria, we are co-leading the ERIN working group on health.
Yes, so Lucy already introduced half of my hat today, being the co-lead of the ERIN Health Group. I represent in Brussels the South Denmark European office, and we are also a reference site for stars with something extra, I think. Yeah, Lucy and I, we have been coordinating this work and this group for many years now. So thank you for inviting us for this work today.
Time and all your efforts. I'm very sure we are in for a very interesting continuation of our webinar. Now I give the word to Victor to give you some more technical explanations, and then we are going to break into 2 sessions.
Thank you, Alenka. We are right on time. I just what I wanted to do is just calm you down, because now we're going to split into 2 different sessions. Please be patient. It might take some time. It would be the system will automatically divide participants, and then Bostian will have to handpick the speakers and the right moderators and put into the right room. So be patient and don't leave, and we'll see each other in the breakout session. Many thanks.
We took about 5 minutes to do that, so go ahead.
It's fine. During this time, I've organized everything, so it should be instantaneous. But just one thing, once the breakout sessions finish, don't press anything. You'll be automatically placed back into this main room. Thank you. Are we ready?
We are ready.
Okay, fingers crossed.
Let's go.
So we have Lucy. Can you give us a report from the breakout session 1?
Yeah, so
Thank you.
first of all, I wanted to thank all the speakers for their very interesting presentation, and then we had interesting discussions also. We had a lot of different questions and discussions, so it won't be easy to wrap up, but I will try. So I've noted down some ideas. We discussed a lot about motivation. So we've seen that motivation of the older people is key to have any initiative on this topic working. To make sure that this motivation exists, the older people should be put at the center from the very start of the project. So that's something I'm taking from the discussion. Regarding digital, we also had some talks about digital. So as far as I understood, the speakers agreed to say that digital tools are a very interesting tool, but they should be integrated in a more holistic approach. So they are a good tool if they are thought as a complementary intervention to physical activities and to personal contacts. And also it brings, well, the introduction of digital tools brings some other challenges. So for example, the education of older people in using digital technologies. Also the question on how do we integrate empathy, these digital tools, because this empathy should be a central also element when dealing with older people empowerment. So this is valid for digital tools, but also for practitioners and doctors. And also noted down that cooperation between private and public sector is necessary to have the innovations being implemented in the different health systems. And I think that that's it for my side.
Alenka will take over. I should continue.
Thank you, Lucy. Thank you very much. It was really concise, and we have a lot to work together. May I ask now, Henriette?
Yes. We also had a very interesting workshop, and I would also, like Lucy did, thank you again, the speakers. And we also talked about motivation in our group, of course. It's very important because as we all know, the introduction of new technologies, it's only about 20% about the technologies. All the rest is about motivation, cultures, training, and so on. So that is really important also, motivation. And coming back to motivation, it's also a question of bringing in the stakeholders from the very beginning, how you actually motivate people to participate. And some of the barriers here is actually when you, for example, as they have done in Denmark, work with design thinking and approaches, that actually from the beginning, you cannot really sell the product and the project, because if you have to stick and be true to design thinking, you cannot say from the beginning what is actually the product from the project. And that is a bit difficult and can be barriers because, well, professionals, they are sticking very much to their daily work, and people themselves can also be a barrier to work with design thinking. Right now, we are in a change of paradigm in relation to all kinds of these empowerment issues of elderly people and also the professionals. When talking about design thinking, and we can see that in many of the EU programs as well, they want projects to be more focused on design thinking. But I have experienced myself that then we really also need the programs to be, a bit more flexible, so that you do not have to explain everything in details about your final product. If you want to use this design thinking, you need also the funding programs to be a bit more flexible. We talked a bit about what kind of recommendations that we want to bring on European level. And we were talking about health, that we actually need a new definition of health. We need a much more holistic view. We need to see it not only as a cost, but as an investment. And then we were talking about now on European level, we have a Green Deal. Why don't we have a societal deal where we can focus on all these social issues and health and empowerment and physical activities and so on? We also talked about that we need a bit more evidence focusing on what are actually the benefits of using IT tools in relation to older people and empowerment of older people. A very important comment in the end of our workshop was that we are never too old to bring in changes in our life, and especially also focusing on physical activity. And when we talk about all these things, it's really important to keep it simple. We don't need to be too complex. It's important to keep it simple so that we can all understand it. And then in all these discussions that we have and program objectives and so on, we need also to focus much more on the people who are involved in this and not always focusing on the technologies. That's what I had brought up from my workshop. So thank you.
Thank you, Henriette. It's wonderful, and I really, it really talks to our hearts. It's really, really very important, and we can bring some important messages to the European Commission, I think. Great things. Because of the time constraint, I would now give the word to representative of European Commission, DCConnect, to Irina Calderon. Irina, if you are with us, the floor is yours. We are perfectly on time, and I'd like to thank again both moderators to be so timely and so excellent in your moderating the sessions. Thank you.
Hi, can you hear and see me?
Yes. Hi.
Okay, so I wanted to thank you for this invitation and for also for listening to the input from everybody, which has been very, very interesting for me. And especially because we in DigiConnect have been working so closely with EIP, and currently I'm the project officer of this initiative, and on aging with technologies, and we have our future programs on to continue to help this societal challenge. I've prepared some very long slides, but I would go through them rather quickly because yes, some of my comments would come with the slides. I wanted maybe to draw your attention to this report on demographic change, which was published earlier this year in April by the Commissioner Suiza, who is the Commissioner for Demography and Democracy, and who is going to also publish a new green paper on active aging in January in the coming year, which is a policy paper intended to government and for member states ministries on how we should empower people who are becoming older and with the growing aging population. So very quickly on some of the outcomes of this report, which are for sure not new to any of you, is that our life expectancy has grown, that we have less children, and in 50 years, the share of people above 65 would be very high, so more than 30%, and the share of people above 80 years also would be significantly higher. So it says here 13% too. Next slide, please. Then another outcome of this report is that we have a very changing composition of our household. So we live either in monoparental families, or in people where there are no children, or people simply living alone. And of course that we are moving from one region to other region, mostly from poorer regions to richer and more prosper regions in Europe, and finally that our population here as a whole in Europe is shrinking in comparison to the world population. Next slide, please. You have already heard about the AEL program. We have also worked quite extensively on promoting the awareness of this growing silver economy, not only on how we could produce more digital technologies to support all elderly people living independently in their home or in their communities, but also to be aware that the elderly population is a population of consumers and who can actively contribute also to the economy, and also that with the help of digital technologies we could continue to develop our careers also after the age of 60 or 65 for our hobbies and be very active contributors of society. So there are quite a lot of different aspects in how we could deal with this, let's call it a demographic change. Next slide, please. You obviously know about European Partnership on Active and Aging being a very, very big and important part as reference sites, because so I would not really talk about it, but the reference sites, as far as I know, have been supported by the Commission, not so much financially, but more on a political level. And this would also continue in the coming MFF. And maybe at the end of my slides, I would come back to this. So please, next slide. Another aspect that was important for me to mention is that the Commission and especially we in Connect have worked for a long time on different ways to empower patients and citizens and health care professionals, but also informal carers who are often those who take care, who actually care for us when we grow old. This is fully in line with the third priority of the communication on digital health and care, which was published in 2018. The other ones being on access to health data and interoperability, and to pulling health data together. Next slide, please. And maybe this is interesting. During this last 7 years of Horizon 2020, we in our unit, eHealth, Wellbeing and Aging, managed more than 880 projects in the field of digital health. Many of them, I would roughly say at least 40%, related to the aging population and how to empower aging people to live independently. And we have learned from this program, and we have heard this from many projects and from some of you, that some important things that I heard also today, that it's very important to co-create those solutions. It is very important to co-design them, to involve patients, to involve the demand side and the supply side from the very beginning when we create a certain solution. But we have also, what I heard today is also very very noticeable from when we look now at the end of this framework program, the big challenge of scaling up those innovations, of making those innovations actually used both by practitioners or facilities or by industry. So the percentage of these projects that we have funded in these years, which is today deployed in a hospital or by a doctor or is on the market, is extremely low. So obviously the Commission is quite aware of this problem that which comes also from all kinds of different aspects. So it comes from lack of awareness very often, and from also some lack of incentives. But I think for health practitioners to use those tools. So to some extent, finding good reimbursement schemes and is very important to include those in the practice. But also someone mentioned to show to evidence that people are actually empowered and what is the usefulness of this technology. So really this is very important. I think for also for the future, for increased deployment of such solutions. Maybe something that someone mentioned is the impact of COVID, and I think also my colleague from DigiSantem mentioned on telemedicine that there has been a very huge uptake of digital solutions for now due to COVID, and it is fully understandable. And I have also heard from some other living labs a very interesting comment some month ago that all the telemedicine systems that existed for 15, to some extent even 20 years already that they were there, where there was never really an incentive to deploy them, or for the doctors to find the time to learn how to use them, because sometimes it is not only 1 or 2 or 3 tries that you have to do in order to use a system well, but such extraordinary circumstances such as COVID have really made it evident that those remote digital solutions are needed. Yes, please, next slide. This is just a very short examples of some of our projects that we've managed. So those are very different projects, whether related to age-friendly environments and remaining at home, or to help older workers to better adapt to their working place, or projects to frailty. Quite a lot of projects on robotics, but I would skip this. So please, next slide. Yeah, next slide. Yeah, maybe what the future holds. So the Commission would obviously continue to support the digitization of health and care systems in its future programs, also with the Horizon Partnership on Transforming Health and Care Systems, with the new EU for Health program, which also has quite a lot of topics on acquiring digital skills and the uptake of telemedicine. Then we would also have the Recovery and Resilience Facility, which my colleague mentioned, and finally Digital Europe program, which is a program designed to deploy technologies for key sectors, whether it's manufacturing, agriculture, but also health. And of course, not to forget cohesion funds, because those are the very big chunk of funds in the EU, which with which very often so ready-to-market solutions and digital technologies that have already proved themselves can be deployed. Yeah, so next slide, please. Very quickly, a little bit on the recovery and resilience plan, which is of 750 billion. There would be crucial investments in health, as you can see. So, of course, it says here challenges related to green and digital transitions and to create sustainable growth, and may contribute to more resilience in European member states. So when it comes to health, there are different strands, whether those are hopefully finally the full deployment of electronic health records and interoperability, and then the use of health data. My colleague already spoke a lot on the European health data space, so I would not repeat this. Next slide, please. Yeah, and this is my last slide. So in depth, in Digital Europe program, we would also support a large-scale creation of digital innovation hubs across all regions of Europe. So as some of you know, the concept of digital innovation hubs, they are co-financed by member states, so they could be co-financed with cohesion funds, and we would work under the Digital Europe program to create a network of such hubs working on health in order to achieve more cooperation and sustainability, because what we also learned from you and from many of our projects is that we have to support regional actors. We have to make sure that innovation and capacities are exist on regional level to help innovators in their ecosystem and in where they create and when they are needed, because very often a top-down vertical policies and instruments take longer, but they complement each other. So we would, with this digital innovation hubs to be deployed in all regions, we would like to make sure that there would be the opportunity to have short-term trainings on digital skills for citizens and patients and doctors, as well as for innovators to be able to test their products with advanced technologies, but also to help innovators and ecosystems really create a market strategy and to help them deploy their products in a more large scale, and obviously also to promote a better and more sustainable, stronger ecosystem and a network between those different actors in the whole union. So I think that my last slide is a simple goodbye. If you have any more specific questions also to me, please don't hesitate to contact me, and I'm very thankful for your invitation today.
Thank you very much, Irina. It was very interesting and quite in line with what we were discussing about. It's time to say goodbye. I would like to say only put two statements. I mean, today's very interesting webinar showed that reference sites can be a powerful tool or co-creators of policies for European Commission, because we can participate in co-design policies, and because reference sites know what's going on, and the more important thing is that we could strive to put people in the center of healthcare systems. I mean, it is very important that people are the center, not technologies, as you already mentioned, Irina. And we should be all aware of it. This is why I like so much this societal deal, which Henriette mentioned. And maybe we can work something more on this in the future. I would like to cordially thank everybody for your wonderful work. And I think we should have some more webinars in the future, or preferably we should meet in person. Thank you to everyone.
Thank you for organizing. It was interesting. Bye.
Bye.
Amazing.
Bye.
Thank you very much, Olga. Thank you very much, Annette, Victor. It was wonderful. Thanks very much.
Thank you.
Thank you very much.
Long live the reference regions. Okay.
Bye.
Christian, if I leave this, is something happens to everybody out?